By March 2003, SARS, which was first found in Southeast Asia, had put the whole world into an unexpected panic. While 90% of patients have recovered from it, those chronic patients and unhealthy people have continued seriously, and 3.5% of them have died. SARS had spread rapidly without having to verify its real cause through the respiratory organ. People had no other choice but to fear the disease, since we cannot live without breathing, and people are therefore exposed to it naturally. Diseases can be infected in various ways, though once it is infected through the respiratory organ, it will be in a greater danger. This shows how important the respiratory organs are to us. We could witness the increase of respiratory organ diseases as the season changed and cool winds begin to blow. This is due to a sensible response of respiratory organs to the environment. But just because the seasons change or the environment is seriously polluted, that doesn't mean we can live without breathing. So there is no other choice but to look after our respiratory organs regularly. Korean traditional medicine aims to bring cures by balancing up the internal organs of the body. While healthy people can adjust well to the change of environment, it is the beginning of agony for patients with respiratory organ problems when cool winds start to blow. While it is common for our sensitive nose and bronchus to not be able to adjust easily to the change of environment, this greatly affects our everyday living when they become really serious. Especially when there is a blow of yellow sand, usually from China, and high pollution, symptoms rage. Rapid industrialization and increasing stress cause our body immunity to drop and affect our respiratory system, which is the most important part in maintaining life. Respiratory organ disease does not only affect the nose and mouth, but also extends to the lungs and bronchus. Hence, Korean traditional medicine emphasizes the strengthening of lung function, since it believes that respiratory organ disease is directly related to it. Our lungs, as one of the 5 major organs, control breathing and are responsible for the transference of body organs occurring inside the body. They also help and support the heart in regulating the flow of blood. Asthma is a major respiratory organ disease. It refers to the signs of a sudden respiration problem and dyspnea with wheezing. It also has symptoms of excessive breathing and coughing. The bronchus is more sensitive, so it tends to react easily, even from a slight stimulation. As these patients have trouble breathing, their faces and lips can become very pale. Asthma is known to be a common disease, where over 150 million people are suffering from it throughout the world. In the case of Korea, the numbers of child asthma have increased to double in 1990 since 1980, and had almost tripled by the mid-1990s. While the symptoms appear most during childhood, the number of patients in their 50s and 60s are now increasing. It is expected that the greater the advancement of the society, the greater the chances of asthma problems occurring. The cause of asthma comprises various factors. A cold environment and psychological reasons are some examples. It could occur together with an increase in body temperature, or through an infection and ill functioning of the lungs and kidney, or people can simply be born with it. Overconsumption of nutritious food and food additives are also factors of the cause. Warm indoor temperatures due to a lack of ventilation could increase microorganisms and louses, which are most harmful. This can then become a direct cause of asthma.
한약에서는 천식을 효천증이라고 해가지고 예를 들면 증상 자체가 숨이 막 가쁘고 또 목에서 가래 끓는 소리, 요즘 흔히 얘기하는 그 천명암 같은 거, 그 피리 부는 소리 난다 그러죠. 쌕쌕 거리는 소리, 뭐 그런 소리 날 때를 우리가 그 천식으로 보고 있죠. 근데 그런 것들은 예전에는 그 오래전부터 문헌적인 기록은 많이 나옵니다만은 거기에 대한 표현들을 꼭 기관지 천식이다 이런 그 용어는 쓰지 않고, 예를 들면은 그 환자가 나타내는 증상들, 그 증상들을 중심으로 해서 이제 기술을 하고 있죠. 하나 예를 들어 본다면은 이제 그 효휴라 그래가지고 숨가쁜 정도가 아주 심하고 그 가래 끓는 소리가 사자 울음소리 같다 그래가지고 효증 또는 효증 막 이런 식으로 해서 쭉 내려오고 있습니다. 그런 것들이 요즘 얘기하면은 막 기관지 천식에 해당된다 이렇게 볼 수가 있죠.
Korean traditional medicine never treats asthma with a single treatment. The fact that it is able to verify the cause of each individual patient is enough to state that there are over 100 treatments for each disease. Firstly, it observes the main symptoms of lung function, and once it is verified as asthma, then it decides to what symptoms it should be classified into. In general hospitals, lung function is examined more scientifically through medical testers. As well as the lung capacity, a patient is asked to breathe, and the speed of air consumption is measured. Through these tests, the cause of respiration problems are found. Again, through this test, lung function is checked, whether it is normal or not. If it is not normal, then we have to determine whether the function is too weak or too strong. As compared to a normal person, asthma patients' lung capacity appears to be less. After injecting medicine to expand the bronchus, if the lung capacity shows more than 13% difference from before and after the injection, it would be regarded as an asthma patient. Korean traditional medicine defines weak lung function as a deficiency syndrome, and strong ones as an excessive syndrome. Thus, treatment will vary accordingly.
한약에서는 기관지 천식의 치료를 막 크게 세 가지 정도 나눠볼 수 있을 겁니다. 하나는 약물요법, 그다음에 뜸요법, 침요법 이렇게 세 가지 나눠볼 수가 있는데 약물요법은 그 환자 개체에 따라 가지고 또 개인의 특성 또는 그 병을 일으키는 원인에 따라서 각각 그 약의 선택하는 게 달라지게 될 수 있겠고요. 또 침요법은 우리가 흔히 실증일 때 침요법을 응용하고 또 반대로 완액이 허증일 때는 뜸요법을 이용하고 있습니다.
It basically clears sputum and softens the lungs. Treatment is given by dividing the steps into before and after the disease. Medical treatment is given upon the time of occurrence and its symptoms. Chinese balloon flower, evening primrose, 5 flavors of schisandra, and apricot almond from the seed of the apricot are all important ingredients commonly used in traditional Korean medicines. Depending on the strength of lung function, asthma treatment method is due to vary accordingly. Acupuncture is often applied if the disease is acute or when lung function and respiration organs are excessive as compared to a normal person. Acupuncture works by stimulating the lungs and kidneys. On our back, there are blood spots which react to the lungs and bronchus. The main spot is the acupuncture point for the lungs. Taking the backbone as the center, the point is located between the 3rd and 4th vertebra, moving 3 centimeters each side. By applying acupuncture to this spot, it removes phlegm and regulates the flow of vital energy in the meridian system of the lungs and kidneys. For asthma, which commonly occurs due to low temperature, Moxibustion is an important treatment. In contrast to acupuncture, it is used when the lungs and kidney function are weak. That is, it is applied at a deficiency syndrome. Heat will be accelerated when Moxibustion made of mugwort is applied to the acupuncture point. When the symptoms are outrageous, both methods should be applied for a faster effect.
뜸은 열을 이용하는 것이기 때문에 뜸의 원리는 그 열이 인체의 기혈을 원활하게 소통시켜주는 데 있습니다. 그렇기 때문에 인체가 굉장히 차워졌거나 아니면 인체를 활동시켜주는 기운이라고 얘기하는 양기가 많이 떨어졌을 때 뜸을 사용하게 됩니다. 뜸을 사용하게 되면 뜸의 열 에너지가 인체 내로 들어가서 혈액 흐름을 빠르게 만들고 기의 흐름도 원활하게 합니다. 그렇게 함으로써 조직이 재생되거나 아니면 기가 활성화돼서 질병을 치유할 수 있습니다. 또한 뜸을 뜨게 되면 인체 내 면역 기능이 활성화돼서 질병에 대한 예방 효과도 있습니다.
It is a special Korean traditional medicine treatment for preventing and curing diseases, usually by inflaming mugwort to stimulate body heat to bring about a regular reaction. It is even called a mirror of organs, and the special features of skin are very much related to organs or nerves. When skin is burnt by moxibustion, it stimulates heat on the nerve or the system, hence tensing the brain and spinal cord nerves or autonomous nerves, as well as changing corpuscles. Moxibustion is classified into two types. First is a method which creates a small scar from burning mugwort directly onto the skin. This causes a nerve reflection through the heat stimulation, and it also is effective in gaining immunity. This is done by leaving a slice of garlic or ginger between mugwort and the skin to bring about an effect of a nerve reflection. Well then, how will our body react when moxibustion is applied? The effect of moxibustion has been observed through a change of body temperature. We have checked the change by distinguishing people with good disperse and non-dispersive heat before and after moxibustion. The blue color over the stomach before moxibustion has changed to yellow and red, indicating the heat after it is applied. The same was applied to the arm and leg. Overall, the blue color has and can see that red color has increased to disperse after moxibustion. Our body tends to have diseases if the body heat is not dispersed evenly, having too much heat in one area or too little heat in another. Recently, in treating asthma, aromatherapy has been used increasingly as a supplementary treatment. This method had been used in ancient Egypt, China, India, etc., treating by smelling the scent of plant fragrantly refined with oil. Korean traditional medicine is currently in the process of researching further aroma effect using traditional herbal medicine. Sore throat and pain for asthma patients due to allergies can be cured by aroma method. Once allergy is determined, the sterilized essence is diluted through an inspirator and the scent is smelled through the nose.
자, 이걸 틀 텐데 틀고 나면은 이 버튼을 누르면은 증기가 나오거든요.
For chronic asthma patients, it would be crucial for them to regulate their daily living habits and food consumption. It is also important to avoid spicy and salty food and drink enough water, and avoid coffee, tea, beer, and food that could induce allergies, as well as refraining from alcohol and cigarettes. Rhinitis is a major disease similar to asthma and other respiratory organ diseases. It tends to occur in people with weak lung function and those who are sensitive to low heat. It has symptoms such as frequent sneezing, runny nose, or blocked nose due to an internal infection. 45-year-old Mr. Key has been suffering from rhinitis for over 10 years. Because of this, he is unable to breathe through the nose and complains of inconvenience, especially due to a drop in consternation. Thus, he would need to breathe through the mouth, and this forces him to take in unfiltered air, causing his immunity to drop, and increases the potential for laryngitis and pneumonia.
굉장히 이게 재채기나 콧물 나오고 하여튼 사람을 힘들게 하는 것은 하여튼 일에도 막 부담스럽고 그래요. 막 부담스럽고 하루 종일 그러다 보면 너무 힘들 때는 누워 있는데 누워 있을 수도 없잖아요. 일을 해야 되기 때문에 그러거든요. 눈이 가렵고 눈도 가렵고 또 심하게 재채기가 되면 코도 부어가지고 숨쉬기도 힘들어지고 나중에는 힘들어지고 머리가 아프고 하여튼 굉장히 힘들어요. 하여튼 너무 힘들어요.
The nose is the external window of the lungs. It is only natural that life can only be maintained once respiration is carried out properly and oxygen is supplied to the body. It is responsible for maintaining regular moisture in the air and filtering dust and other substances as the nose sends it to the lungs. Korean traditional medicine states that rhinitis is not only a nose problem, but all problem symptoms of organs such as the lungs and kidneys occurs here. Pollution, especially allergy rhinitis, and the diseases that cause inflammation in the nose have tripled in the last 20 years. In the USA, 17% of the population is suffering from this, and about 10% in Korea. Rhinitis can be classified into two types depending on the level of allergy. For non-allergy rhinitis, the causes could be due to the structure of the nose, pregnancy, or problem with internal secretion organs, or overstress. In the case of allergy rhinitis, on the other hand, you could become sick from antigen of pollen, indoor dust, etc. Indoor dust, acirid, filamentous fungi could also induce rhinitis, as well as cold air and a sudden change of emotion. Korean traditional medicine states that when there is a drop in the immune system due to weak internal nasal condition, lungs, or kidneys, warm and cold wind from outside attack the nose, hence causing rhinitis. Consequently, Korean traditional medicine treatment for this emphasizes the strengthening of immunity. The cause of this disease will be broken down, thus requiring different treatments.
비염은 우리 한의학에서는 크게 원인이 외인과 내인으로 구별을 해요. 외인이라는 것은 바깥의 원인, 내인이라는 건 내부적인 내 자신의 원인. 그래서 외인이라는 것은 이제 공기가 차거나 아니면 공해라든지 또는 뭐 이렇게 나쁜 오염 물질 이런 것 때문에 원인이 되는 거죠. 주로 이제 알러지 비염이 거기 속하죠. 그다음에 내인이라는 것은 자기 자신의 이 면역력이 떨어지고 저항력이 떨어져서 오는 병들. 그래서 이제 내부적으로 생기는 거, 축농증이라든지 이런 것은 오히려 내인이 많고. 알러지 비염이라든지 이런 것은 이제 외인이 많아요. 그래서 그걸 구별해가지고 이제 적절하게 치료를 하죠. 물론 이제 두 가지가 합쳐서 오는 경우도 있어요. 그래서 치료법이 조금 다르죠.
Rhinitis treatment also uses traditional herbal medicine, acupuncture, and moxibustion, where the herbal medicine is the main method. It is prescribed upon the individual patient's status, especially looking out for different body types, such as high or low body heat. Patients with a weak heart, lungs, and circulatory function, and low body heat patients are given medicines to warm up the lungs. This has an effect in strengthening immunity, thereby recovering not only rhinitis, but also tiredness caused by low body heat, enervation symptoms, and indigestion.
몸에 이제 열이 많은 타입이 있어요. 그런 경우에는 이제 주로 갈근 해기탕이라는 약재를 많이 써요. 우리가 이제 흔히 이제 시중에 있는 그 칡뿌리, 그게 이제 주 재료가 들어가는 이 갈근 해기탕이라는 약을 쓰고 그렇게 하면 내부에 있는 이 열, 간에 있는 열이 빠지고 내부 면역력이 커지면서 이제 또 자체적으로 외부의 그 비염을 이길 힘을 키워주는 거죠. 그래서 코의 병이 낫다고 코만 보고 치료하는 방법이 아니고 한방에서는 그 사람 내부에서 원인이 어디 있는가, 뭐 간에 열이 있는 게 원인인가, 아니면 폐가 찬 게 원인인가, 이걸 찾아서 적절하게 그 열을 꺼주고 또 찬 것을 따뜻하게 데워주고 이런 방법으로 우리가 치료를 하죠. 좀 방법이
For rhinitis treatment, while the typical acupuncture emphasizes caring for the pain of bones or muscles, the individual body type acupuncture aims at regulating all 5 viscera, including the gallbladder, stomach, small and large intestines, the paunch, and bowels.
그래서 두 개 병행하면 효과가 물론 더 좋죠.
Before acupuncture is applied, it is very important to examine the pulse rate accurately and find the exact body type of the patient. Different acupuncture is applied depending on the patient, and it is only done for a stimulation effect rather than leaving it on the skin. In contrast to the typical acupuncture that only gives a physical stimulation, medical acupuncture is also used for asthma treatments. This is a treatment whereby injecting medicine to acupuncture points through acupuncture. As this can derive effects of both acupuncture and medicine, the medicine is made by abstracting traditional herbal medicine materials. Effects can also be achieved by simply injecting the medicine into the acupuncture points without having to take medicine. Treatment effect for rhinitis can only be achieved by taking precautions in our daily routine as well as a long-term treatment. Rhinitis patients should be careful not to be exposed to the environmental hormones emitted from new apartments and maintain a moderate moist environment and temperature. Cold breezes should be avoided when sweating or after a shower, as well as instant foods. It is also important to reduce stress as much as possible. Whether a person is alive or not is determined by checking the breathing status. Hence, respiration is the most basic and the most important factor of life. In order not to suffer from respiratory organ disease, while avoiding factors that could cause the disease is one way, taking care of the internal organs that are related to the respiration is another important option. Korean traditional treatment therefore aims at this point in treating respiratory organ diseases. Korean traditional medicine treatment states that a bowl of rice is full of nutrition. Hence, rather than taking medicine or acupuncture, another way to cure diseases is by eating all foods on our dining table. Well then, what sort of ingredients of food will be most helpful for this disease? Respiratory organ disease will always be related to the lungs, and the best food is found to be beef. From the time of Koreans' ancestors, beef is best cooked with a vegetable called balloon flour, since it is known to be just as effective as ginseng, and it works to reduce sputum. It also has an outstanding effect in removing the pus, so it is especially good for asthma. A barbecue stick made of beef and balloon flour is another great tasting food for asthma, with high nutrition when it is fried with flour and egg coating. Powdered medicine from the root of plants, found along Japan and Korea, are found to have been very effective for the lungs and bronchus. According to Korean traditional medical books, powdered medicine is even recorded to strengthen lung and enhance vital energy. Making the soup is simple. Firstly, cut the peeled powdered medicine and grind it in the mixer. Then cook it over a light heat. There are other good foods for respiratory organ diseases that remove sputum and clear headaches, such as mixing balloon flour with chili sauce. Wild plants are also good for lung function, and they have even been considered as an adjuvant of bronchus. They are good to take when coughing or when the throat is stuffy and sore. Gingko nut, which is also used in the traditional herbal medicine, removes sputum, cold and asthma, and it even warms the lungs. Chestnuts are efficient in recouping vitality and strengthen internal organs and the stomach. Since all foods have their own nutritional value, once we acknowledge what they are, we should not only be eating these foods, but also realize that we are taking in medicine at the same time. So, if you are having problems with respiratory organ disease, such as breathing problems and coughing, how about revitalizing your lungs and bronchus through a good selection of food?